Hi, everybody. How's it going? My name is Dr. David Macias. I'm an orthopedic foot and ankle surgeon here at OrthoVirginia, and welcome to our Facebook Live. For those of you who are not familiar with OrthoVirginia, we're the largest multi-specialty orthopedic practice in the state of Virginia, and we have offices all throughout the state. If you need more information about OrthoVirginia, you can visit us at orthovirginia.com. Now, we're going to get into the meat of what we're talking about today, and we're going to talk about bunions. And so, first of all, what does the word bunion mean? Where does it come from? Well, there are two origins. There's from Latin, bunio, B-U-N-I-O, which means turnip. And who thought it looked like a turnip? I don't know, but that's where the word comes from. And then from the old French, bunion, which I'm sure I'm doing terrible with the pronunciation, which means a bump on the head. And so if we look at a picture of a bunion, these things are really deceiving. These terms are really deceiving because they kind of infer that a bunion is just a bump that grows on the side of the foot. And that's not really what happens. If we look at an X-ray of the foot, what we'll see, as you can see here, is that there's actually a change in the angle of the bones in the middle of the foot. And so when we look at this picture, this is an X-ray of a foot of a patient of mine who had a bunion. And you can see the long bones, those are called the metatarsals. The metatarsals in this picture to the lesser toes, toes 2 through 5, are all pretty much parallel and pointing straight ahead. But what you see with the bunion, with the first metatarsal that's connected to the big toe, is that it's starting to angle over towards the other foot. As that metatarsal angles over towards the other foot, what happens is that the muscles that attach to the toe start to go under tension and pull the toe over. That gives us that V-shaped deformity with that prominence on the side. And so, as you can see, it's not really just a bump that grows on the side, it's actually a change in the angle of the bones in the foot. Well, what causes a bunion? People like to blame it a lot of times on fashion shoe wear, wearing high heels and things like that. But really, there's much more of a hereditary component to it than anything else. So people will often come to see me and say, I've got my mother's feet or my grandmother's feet, my great aunt Susan's feet, things like that. It's more common in women than in men. And some of that may be due to underreporting in men. It's much easier for men to hide a bunion and to accommodate it with men's shoe wear as opposed for women. What are the symptoms of bunions? The number one symptom is pain at that prominence on the inside part of the foot. You can also get swelling and redness at that prominence, and you can have difficulty with shoe wear. How do we treat bunions? Well, the number one way we treat bunions is by accommodating them. That means buying wider shoes. Most people know that a 10 is bigger than a 9 for a size shoe. However, what that number refers to is the length. So a size 10 is going to be longer than a size 9, but there's also a letter associated with that shoe, and that letter is the width. And that goes usually from a B to an E, or sometimes a double E, triple E. And so if you have a bunion, the first thing to do is buy a shoe that has a wider toe box. Other things that you can do are to take medicines, such as over-the-counter medicines, Tylenol, ibuprofen. If you can tolerate those medications, those are good things to help with bunion pain. You can use a pad to help pad that area to take some of the pressure off. And you can use something like a toe spacer or a toe strap to try to pull that bunion back over. Now, a couple of things to note about spacers and toe straps. Those are not going to correct a bunion. Those have never been shown to correct a bunion, change a bunion, or prevent a bunion from getting worse. Those things can make you more comfortable and make it easier for you to tolerate the bunion. But once you take them out, the bunion will come back over into its original position. We do know that over time, bunions do get worse, but over what time period that is, that changes for every patient. It's very individual from one person to the next. If these things don't work to help you with your bunion pain, then when is it time to consider a surgery? Whenever I talk to patients about surgery, there's really 4 questions that I ask, and this goes for just about any surgery. The first question we ask is there even a surgery we can do to treat this problem? For bunions, the answer to that is yes. There are some problems that are better treated with physical therapy, some with medication, but for bunions, there are surgeries that we can do to correct the bunion, and we'll talk about that a little bit later. The second question is, are you getting pain every day? If you're getting pain once every 6 months, once every year, only when you wear a certain pair of shoes, I don't really think that it's worth it to undergo the bunion surgery just for minimal pain like that. However, if you're getting pain every single day, almost every single day, then that's more of a serious problem. The third question is, have you failed treatments that are not surgery? Have you tried buying wider shoes? Have you tried medications? Have you tried pads? And those things been unsuccessful in providing you relief. And the fourth question is, has this problem affected your quality of life? Does it prevent you from doing the things you want to do? For example, I don't want to go on vacation with my family because I know my foot's going to hurt and I'm going to have to sit down frequently. I don't want to go working out. I don't want to go hiking or exercising with my loved one. If the answer to all four of those questions is yes, yes, I get pain every day. Yes, there's a surgery I can do to correct my problem. Yes, I've tried things that are not surgery to make it better. And yes, it affects my quality of life. Then I think a surgery is reasonable. So how do we fix these bunions? Well, you have to remember the bunion is not just a bump. And so the bunion is actually a change in the angulation of the bones in the foot. And so to correct the bunion, we have to change that angle. Now, there are many different ways to do this correction. And I used to do a much more traditional open correction, which got great results. However, there was a lot more soft tissue dissection and initially a little bit more pain moving forward. But as my practice has evolved, I've moved to doing all my bunion corrections in a minimally invasive fashion. And the way we do this is to use small incisions, using special instrumentation through those incisions to cut the bone and correct it using less soft tissue dissection. Often with these minimally invasive corrections, we have less soft tissue dissection and therefore less pain and faster recoveries on average for these. And so we're going to show a video of the burr that we use, which is one of the specialized instruments we use for this. And if we can pull up that video. This is a high-speed, low torque burr. And as you can see it here, I can put it on my skin. It's running right now and it's not tearing up my skin. But as we put it into this sawbones model here shortly, you can see it's going to cut through it nice and easily. And so using small incisions, we use that burr through those in order to get our correction. And so I'm going to show you some pictures of a patient of mine who had a bunion correction usually using this minimally invasive technique. And so here's her foot. This is the same patient that we saw the x-ray of before, and you can see how much straighter her toe is now. And then if we look at the picture from the side, you can see where we just have these 5 small incisions, these 5 small poke holes where we were able to get our correction. And so if we look at back at the first picture, I'm sorry, if we look at the picture, I actually drew where I had my incisions. Here we go. And the red lines indicate where I would have made my incisions for my more traditional open approach. And so you can see the incisions are much smaller with doing this minimally invasive. And so if we go to the next picture, we'll see now we have the pre-op and the post-op, and you can see what a great correction we were able to get, again, using this minimally invasive technique. After you have surgery to correct your bunion, my protocol, I see you about every 10 days after surgery. I do all your dressing changes. I put you in a special shoe that you wear for the first 4 to 6 weeks. After that time, we switch to a roomy, comfortable, supportive tennis shoe. And between 10 to 12 weeks, we're normally returning to regular shoe wear and to regular activity. If you're looking for more information about bunion surgery or about any other orthopedic issues, there are some great websites you can go to. Orthoinfo.org, which is sponsored by the American Academy of Orthopedic Surgeons. footcaremd.org, which is the patient information site for the American Orthopedic Foot and Ankle Society. Bunionpain.com, which is a patient marketing site for Arthrex, which shows patient testimonials for using minimally invasive bunion correction. And of course, OrthoVirginia.com. And so thank you very much for listening to this Facebook Live. And if you liked it, please share it with your friends. And at this point, I'd be happy to take any questions if there are any of those.
Thank you so much. Yes, we are getting questions. So please feel free to put your questions in the comment section of the video. So our first question is, what is your thinking on Lapiplasty? Is it a worthwhile procedure to fix a bunion?
Lapiplasty is a way to correct a bunion where you fuse the first joint between the metatarsal and the more proximal portion of the foot, or the joint closer to the ankle. It is a great way to correct a bunion. It's not my preferred technique. I think that if that is the technique that your surgeon feels most comfortable with, I think that it is a great way to get excellent correction. But I've found that I've got equal corrections doing this more minimally invasive technique and using smaller incisions to get these bunion corrections.
Thank you. Does icing bunions when they're painful help?
Yes, icing a bunion that's painful can help. So if you have a bunion and you go to an event, a wedding, exercise, whatever that may be, and your bunion is hurting, icing it's a great way to help get some of that pain down. Absolutely.
I have heard that people have their bunions come back after surgery. Can you give any information on that?
Absolutely. If you take all comers, all bunion correction surgeries, the quoted recurrence rate is probably somewhere between 5 to 10%. So that is a possibility. You can overcorrect a bunion as well, where you make the bunion too straight. That's probably a little bit less, probably less than 5%, but those are possibilities for it to recur. I have seen patients who have had bunions corrected 20, 25 years ago, and they come back and it slowly crept back over time. So yes, it is possible, but it's not very frequent.
I have bunions on both feet that wear down the insides of my shoes. Would you recommend having them repaired at the same time or one at a time?
So I recommend doing them one at a time. And you literally want to have one good foot to stand on. And so I don't recommend doing them both at the same time. Heaven forbid you had a complication, there was an infection, a wound problem with both your feet at the same time, or you just had too much pain, then you may not be able to walk at all. You may be using a wheelchair. That can put you at more risk of blood clots, things like that. And so, no, I do not recommend getting them both done at the same time.
Thank you. I was wondering about the effect of bunions on ankles.
I think that bunions are pretty separate from ankles in terms of having any effect on them. Correcting a bunion usually does not affect problems at the ankle. Now, often I have seen patients with a bunion and also with a flat foot deformity that can occur fairly frequently. They're not often both symptomatic at the same time, but if they are both symptomatic, then you may choose a different procedure. Your surgeon may choose a different procedure to correct your bunion in order to correct some of the flat foot deformity at the same time.
Thank you. I know this sounds vain, but I love heels. If I get my bunion repaired, will I be able to wear heels again?
Absolutely. I think one of the benefits to bunion correction is to be able to get back into the shoe wear and the things that you like to wear and the activities you want to do. And so if that's something that's important to you, I definitely think that's a very reasonable goal to be able to get into heels after bunion correction surgery, if that is the procedure that you need.
Can bunion pain be removed by laser?
No, not that I'm aware of. The bunion pain, again, looking at those pictures in the x-rays, the bunion pain is coming from the prominence rubbing against the skin and the pressure that's put there. And so using a laser really isn't going to relieve that.
Thank you. How many days do you have to stay off your foot after you have the surgery?
So different surgeons have different protocols after their surgeries. For me, I let you walk on the heel and the outside part of your foot from the first day. And so for me, you don't have to stay off your foot at all. Now, a lot of patients are having pain, which is very reasonable in the first few days. They choose to just use crutches for 2 to 3 days. But again, what I've found is using minimally invasive techniques, they're recovering much more quickly and walking much more quickly.
Thank you. I'm a runner. How soon after surgery could I return to running, if ever?
I do, again, just like wearing heels, I think being able to return to running is a very reasonable goal. And I do think um, that you would be able to return to that typically after a bunion surgery. We want to make sure that the bone's healed all the way before we let you return to running. That is typically somewhere between 8 to 12 weeks before you can get back to running. Now, I do like patients to be active, and I want you to be able to stay active. There are things you can do like a stationary bike well before that 8 to 12 weeks that you can use to help stay active without running and without risking injury to your foot.
Thank you. Someone says, I have bunions and meet 3 of the 4 criteria. I'm 68 years old. Is it more beneficial to wait until I meet the 4th criteria? Or should I see you now before I get older and perhaps develop issues that might prevent me from being a surgical candidate?
That's a very good question. That's a tough situation to kind of answer through this medium. I think that's one where you really want to have a discussion with your surgeon. And, it depends on what those 3 are. Obviously, if you have a large bunion, then we've talked about the surgical treatments. If the only thing you haven't met, the only criteria you haven't met is you haven't done non-operative things like try wider shoes, I think that would be the first thing to do. But if you are limited in your activity, if you feel like it's affecting your life, then I would come see someone to discuss that further.
Thank you. How soon can you drive if your right foot is operated on?
There's no law that says you can drive X number of weeks after this type of surgery. The only thing that has been studied that I'm aware of is if you have an ankle fracture to your right ankle that's treated with surgery, it takes on average 9 weeks for your break time to return to normal. This is less than an ankle fracture surgery. But again, as I said, it has not been studied. And so the number one thing you have to do, you have to be sure that you're very confident behind the wheel that, heaven forbid, a child runs in front of your car or something like that, you're going to operate the vehicle appropriately in case of an emergency. And so again, it's going to vary for people. It just depends. It's somewhere usually between 4 to 8 weeks. But again, it's very different from one person to the next.
Thank you. Can a custom orthotic help a bunion from getting worse?
A custom orthotic may help to make you more pain-free and be able to enjoy activities such as exercise. But no, a custom orthotic will usually not keep a bunion from getting worse. As I said earlier, strapping a bunion, taping it, toe spacers, those things may help you to feel more comfortable while you are wearing them, but they ultimately are not going to change the course of what happens with that bunion. The bunion, if it's going to get worse, is going to get worse. And a custom orthotic will likely not prevent that.
Thank you. Do bunions affect balance?
Obviously, we stand on our feet and they're the base that everything else comes from. Typically, they do not affect your balance. However, if you're having significant pain, your reaction to that pain may affect your balance. So yes, in that way, they may affect your balance.
Thank you. Can you have outpatient bunion surgery or is it done inpatient?
Absolutely, we do it outpatient. I do outpatient bunion surgery for the overwhelming majority of my patients. The only reason you would need to stay as an inpatient would be if you had other medical issues that needed to be observed overnight. But for the bunion procedure itself, that is an outpatient surgery. You would go home the same day.
Thank you. I know Lapiplasty involves pinning the V-shaped bones together to make them straight. Does your 5-hole minimally invasive procedure involve pinning the bones together? I'm trying to understand exactly what becomes of the V if not shaved.
I see. So we have a picture actually that we can put up of the same patient that we were discussing earlier, and a picture of her x-ray. And so this is typically what it looks like on an x-ray after this surgery. And so what we do with that minimally invasive surgery is we shift over the distal part, the distal part is the part that's closer to the toe. And this is how we get our correction. I also make a cut in the big toe itself and pull that back over towards the other foot to help get this correction. So this is what becomes of the V. We shift it over, we shave off some of that ledge, some of that overhang, and then we pull the big toe back over to help get rid of the V. And so you can see this. Can you pull up the pre-op x-ray as well?
Yes, just a second.
Sure. Oh, perfect. So we can compare the two. You see how we've corrected that V shape. And if you look, not at the bones themselves, but the gray shadow outside of the bone next to the black shows you how much of a correction we have, because that gray is a soft tissue shadow, and you can see how we've changed the angle of that significantly. And we saw that in the clinical picture of the foot as well.
Thank you. What can be done with gout in a big toe bunion?
So gout is a condition where you get crystal deposits inside of the joint. Gout loves the big toe. Gout in the big toe has a term called podagra. When you have gout, if you have a bunion with it as well, the problem becomes, if you simply correct the bunion, the joint itself will still have gout. And so you can still have significant pain from the gout, and you may have a higher likelihood of recurrence of your bunion. If you have gout and a bunion, there may be a better procedure to correct your bunion and the gout at the same time, and that would be what we call a big toe fusion, where we take the joint away to help get rid of arthritis from gout and also to help correct the bunion. That would be my procedure of choice for someone who's had recurrent gout attacks in their big toe and they also have a bunion deformity.
Thank you. My second toe is crossing my big toe. Will that be corrected if the bunion is corrected?
Usually, well, I guess it depends. It depends on how far over it's crossing and how much pain you're having at the second toe. So if you're not having very much pain at all at the second toe itself, that can get better with just correcting the bunion. If you're having significant pain at the second toe, we may have to do a procedure at the same time to correct the second toe as well as the bunion, but that could all be done at the same time.
Thank you. Does weight affect how quickly a bunion grows?
Not that I'm aware of. I don't think that weight affects the rate of a bunion getting bigger. Again, I think what affects that more is more the hereditary nature, more your genetics than anything else.
Thank you. My mother, her brother, and most of my siblings have bunions. Is there anything that can be done to help prevent the genetic bunions from forming in our kids?
Unfortunately not. You know, if you are destined to have them, you will likely have them. And that goes for your kids as well. Having a bunion, simply having a bunion, however, doesn't necessarily mean you have to do anything. The worst bunions I've ever seen in my life, these were terrible, humongous bunions, were in a young male. He was early 20s, and he was a semi-professional weightlifter. And he was a very active individual, and he had no pain. And he just had a huge bunion. And we said, look, if you're not hurting, you don't have to do anything about this. And we don't even recommend doing anything if you're not having pain. And so a bunion that is painless does not need any type of surgery whatsoever.
Thank you. How long after surgery before you can go bike riding?
Before bike riding typically is going to be, if you're doing simply a mountain bike style bike, probably 6 to 8 weeks.
Thank you.
I'll revise 6 to 10 usually, just depending on how your x-rays look and how your healing is coming along.
All right. What happens if you don't do bunion surgery? Will it misalign the other toes?
If you don't do bunion surgery, in general, what will happen is your bunion will continue to get worse over time. And that means the bunion will get larger. Over time, as one of our earlier viewers asked, it can affect the second toe. And it may actually affect the third or even the fourth in really extreme cases. So yes, over time it can get larger and it may start to affect the other toes. I don't recommend doing a preemptive surgery to prevent that from happening because we don't know over what time period your bunion may grow or get bigger.
Thank you. Is surgery for a tailor's bunion or bunionette any different from what you have described?
It is slightly different. A tailor's bunion, for those who don't know, is also called a bunionette, and that involves the fifth metatarsal phalangeal joint. So as opposed to the bunion, which is on the inside of the foot, affecting the big toe, this is on the outside of the foot, affecting the small toe. Similar to my bunion surgery, I've moved my practice to minimally invasive bunionette correction as well. And so it is very similar. The recovery is very similar as well. I would say is probably slightly faster.
Thank you. Doesn't the bunion start at the top of the foot? Is anything altered there or only at the V?
So the bunion, the V, as we were describing, yes, that starts more in the middle of the foot. And that comes over where the metatarsal starts to point towards the other foot or the inside. There are numerous different ways to correct a bunion. Obviously, what I've shown here is a minimally invasive way to correct it. People have asked about lapiplasty. There's an excellent paper that was written not too long ago that showed that 5-year results for minimally invasive bunion correction were equivalent in terms of maintenance of correction when compared to more open techniques at 5 years. And so I think what the question may be getting at is, how are we actually correcting this deformity? If the deformity starts more in the middle of the foot and you're making a cut in the bone down by the end of the foot, how are you actually getting your correction? Well, we're getting the correction by shifting it over, shaving off, using a burr to help shave off a little bit of that prominence. We can correct the rotation through it minimally invasive. And so we're actually able to use these minimally invasive techniques to correct the bunion in a very similar way.
All right, thank you so much. We are out of time for today. We did not get a chance to answer your question. We will answer it later in the comments. Would you like to close?
All right, thank you very much, everyone. I appreciate everybody's attention. And again, if you have any issues or would like to come see me, please visit us at OrthoVirginia.com.